Okay, so today we're going to be talking about natural immune support. And this is kind of a controversial topic right now because of everything that's happening with COVID. And unfortunately, I'm not trying to diagnose, treat anything. I'm just trying to educate on how to be able to boost your immune system naturally, and how to actually be able to support it, because the immune system is a very robust and dynamic system of our body, and it does, just like with everything else, need the vitamins, nutrients, and also avoidance of certain things for it to function optimally. My name is Dr. Vanessa Ruiz. I'm a naturopathic doctor with a focus on holistic mental wellness. And I have a private practice called Enliven Mental Health in Scottsdale, Arizona. I'm also the founder of Nurses for Natural Health, which is an organization that aims to educate nurses about natural medicine. I used to be a nurse, and I struggled really with finding myself in my niche and my specialty. And I don't want nurses to struggle through that, since it was a very painful process for me. And I want them to have the tools that they need to be able to be the healers that they've always wanted to be. Okay, so today, immune health, with everything that's going on with cold, flu season, and also with COVID-19, we do have to arm ourselves and make sure that our immune system is functioning optimally. So today my goal is to just give you an idea of what the immune system does, and also its role in inflammation, to help you understand why nutrition is absolutely pivotal in immune system health and balance, to learn what foods can help the immune system, to help give you a few recipes maybe, and then also how to help with supplementation, and what to do if you get sick. Okay. The immune system is basically the defense mechanism of the body, and it involves many organs, involves even the skin, the cells, and proteins, and there's different ways the immune system functions. You can protect yourself through skin, the mucosa. There's actually naturally occurring bacteria and fungi in your skin, and that helps to also protect it from, it's kind of the crowding effect, protects it from other things growing there. There's also organs like the tonsils, the thymus, which is located in your chest, the spleen, and then the GI tract, which has lymph nodes in it called the galt and the malt. And actually a majority of your immune system is located in the gut, about 75 to 90% of the immune system. So when you think about the immune system functioning optimally, you have to look in the gut. And you have the gut-associated lymphoid tissue, you have the mucosa-associated lymphoid tissue. And if you think about it from this perspective, right, the gut is one of the few places where you're having things from your environment coming into your body, right? It's also the same with a respiratory system. And so it would make sense that you would try to distinguish what is you and what is not you, right? So that you can assimilate that into your body. Okay. And there are two different branches of the immune system. There's the innate immunity, and we talked a little bit about that. And these are basically non-specific approaches of the body to protect itself. So one non-specific approach would be through the acidity in your stomach. So the stomach acids only allow certain things to grow in there. Think about the mucous membranes. Think about the phagocytes, which basically, they're non-specifically eat through phagocytosis debris, bacteria, and they're not as specific as the adaptive immunity, and this is basically the learned immunity. We're talking about B cells and T cells and memory cells. And so when you're exposed to something, you develop antibodies to that. Also, it involves inflammation, that redness, the swelling, and it's a lot more complex because you do end up having an immune system that ends up learning about its environment. So let's talk about inflammation, because I think that this term is starting to kind of get demonized, just like fat, and just like all these other kind of concepts that they just are what happens in the body, right? Inflammation happens when there's infection, when there's illness, when there's injury. It's a very natural response. However, what you want to be careful of is that the inflammation isn't long-standing. It's not just an acute response, that the response is happening for a long period of time. And that's where we also need to kind of look at why that's happening. Maybe you have an infection that's been going on for a long time. During inflammation, there could be white blood cells that increase, immune cells will increase, and also inflammatory cytokines. We're talking about IL-6, endothelin. And these are what kind of gives your body that achy, feverish response. It's not necessarily the microbe itself, it's actually the immune system that's causing all those symptoms. Okay. And oftentimes the immune system can be out of balance, like in autoimmune disease. So what could trigger an immune system to not be in balance? I mentioned earlier about infection, and infection is actually quite common. One of the very common infections is actually dysbiosis. So it's not the typical infection that you think about. In your gut, there should be a balance of certain good bacteria versus bad bacteria, and also yeast as well. When there's an overgrowth of yeast, you can see other symptoms. When there's an overgrowth of aspergillus, Clostridia, then that can cause a whole host of other mental health symptoms as well as malabsorption. There could also be dysfunctional mitochondria. So the mitochondria are involved in, they're basically the powerhouse of the cell, as we learned in high school. However, they're also involved in kind of this process of creating ATP. And that's a very oxidative process, meaning that there's a lot of free radicals that get created when you're creating energy. And the free radicals can sometimes cause inflammation if you're not having enough antioxidants in your diet. There are also hormones and endocrine imbalances that can occur, which can then cause the immune system to be out of balance. So one of the most potent anti-inflammatories is actually cortisol, right? You get a cortisone shot when you have inflammation in a joint space. And so consider that cortisol is a very potent anti-inflammatory. But if you have changes in the cortisol balance, like if you have too much cortisol, or if you have adrenal insufficiency, then that can also cause the immune system to go out of balance. Xenobiotics and toxins. So basically things that are in our environment that can cause a whole host of issues. Very recently, Monsanto had been charged with basically Roundup, one of their products that created Hodgkin's lymphoma in a person who was using it consistently. And so the things that we're exposed to in our environment can actually trigger our immune system to be out of balance. Today we're going to talk more about food and lifestyle, since these are some of the things that we can change in our lifestyle. The xenobiotics also we can change in the sense of maybe minimizing some of the toxins and the chemicals that we're using. However, we're mostly going to focus on food, lifestyle, and also supplementation. We'll talk about inflammatory foods, we'll talk about nutrient deficiencies, we'll talk about the effect of stress as well as the emotionals. Glyphosate is another one that is basically found in foods, and they can actually bind to some of the minerals that we're consuming, leading to some nutrient deficiencies. One very common one is actually manganese. Manganese is a mineral that's found in a lot of our soil and our food. And unfortunately, in the presence of these xenobiotics or glyphosate, it can bind these minerals. It can also cause disruption in the aromatase, which is important for estrogen production. So consider that if you're not consuming foods that are organic, you're actually possibly exposing yourself to this particular chemical and potentially causing hormone and nutrient deficiencies. Okay. Inflammation. There's actually a diet called the anti-inflammatory diet. And what it does is it skews the types of fats that are in your diet from omega-6s to omega-3s. Now, omega-6s in the biochemical pathway, they end up getting converted into arachidonic acid. And arachidonic acid then gets produced into inflammatory chemicals. So essentially with the anti-inflammatory diet, you're kind of starving this pathway and encouraging omega-3s, which are beneficial fats. They also get converted into things like EPA and DHA, all things that are beneficial for our brain. Other things that can trigger inflammation are sugar. So if you're consuming a lot of sugar, that ends up creating more inflammation. You also end up having more visceral fat, and visceral fat also contains more estrogen in it, as well as being able to produce more inflammatory chemicals. What about the role of food and the immune system? So this is really key in balancing your immune system, because if you don't have the sufficient amount of vitamins and nutrients, then you don't have enough of the ingredients for the immune system to function adequately. And oftentimes some of these are really, you can get them from certain foods, like for example, selenium. Selenium can be found in Brazil nuts, in fish, and what selenium does is it helps to produce something called glutathione. Glutathione is one of our most potent antioxidants. Okay. Glutathione is also produced by the liver and helps with metabolism of xenobiotics or chemicals from the environment. It also helps with the T helper cells. So the T helper cells are basically part of the immune system that helps, they're helpers, right? That helps to stimulate and activate other types of cells. One that's also important that you get is zinc. Zinc is an antiviral, and it also helps to reduce a chemical called thymulin, and that helps with the development of T helper cells. Especially with the flu season coming up, it's really important that you're having adequate doses of zinc in your diet. So the typical dose that I recommend for my patients is about 15 milligrams, and that can go up when they're acutely sick. So between 15 to 90 milligrams has shown benefit in helping with viral infections. The next one is vitamin C, and vitamin C is a really strong antioxidant. Whenever there is infection, there is a lot of free radicals that are being produced. And that allows the body to be able to kill viruses and bacteria. Unfortunately, if you don't have enough antioxidants, then that oxidative reaction can cause damage to other cells and other parts of your body. So that's why vitamin C is really important, especially with everything that's going on with the cold and flu season. Also, one interesting thing about vitamin C is that it can help to lower IL-6 and endothelin. And those inflammatory cytokines have been shown to produce something like cytokine storm, which is something that we're seeing a lot with patients who have had COVID. Okay, so having vitamin C and sufficient doses of it can help, especially during acute infection. Okay. Vitamin D3. Vitamin D3 is actually, it's actually considered a hormone in the brain, and also has a lot of functions such as immune cell signaling. It can upregulate calcium that we know of. It can also help to stimulate the neutrophils, which are strongly antimicrobial. If I see a patient with low vitamin D levels, it makes me question whether or not there's an inflammatory process going on, especially if they're also supplementing. Okay. So vitamin D3 is important for the functioning of immune cell signaling and balancing the immune system. Vitamin A. Vitamin A is great for acute infections, especially respiratory infections. Your body requires this to be able to produce antibodies. Okay. The only caveat is you want to be careful in dosing, because if the patient, the female, is in reproductive age, if you go higher than 10,000 and they're pregnant, it can be teratogenic. So you want to be careful with vitamin A. Okay. And any kind of antioxidant, so that could be vitamin C, that could be CoQ10. These help to kind of quench the destructive waste whenever there's an oxidative process going on. So if there's inflammation, if there's infection, then that person probably needs to be on some kind of antioxidants. Let's talk about some beneficial foods. So having some kind of fermented food and probiotic is beneficial for the immune system, because again, remember, it's all in the gut, and having probiotics on board can actually create a crowding effect, right? So you eat probiotics and it helps to keep the other bad bacteria at low levels. It can also help to modulate natural killer cells and T cells, and it can also help with the innate immunity and monocyte activity. So monocytes are they're kind of non-specific immune cells that will phagocytose or consume or eat debris and non-specific foreign objects in the body. Okay. Also make sure that you're having beneficial fatty acids, because this can help to counter inflammation. So I mentioned before about the anti-inflammatory diet. So you would consume foods that are high in omega-3s. So these are generally plant-based. So think about chia seeds. Think about flaxseed, because that contains a lot of omega-3s. And also think about fish oil, like cod liver, or you can also consume fish. However, if you're going to go that route, you want to make sure that it's wild caught and it's cold pressed. Okay. Also, hemp seed oil provides omega-3s. And then also whey protein. So whey protein contains the amino acids in it, like N-acetylcysteine, that can help to produce glutathione. That again being the major antioxidant of our body. Okay. And you can also make your own probiotic non-dairy yogurt, and it's really fast. So you basically take coconut milk from the can, okay? Or you can make your own homemade fresh almond milk. So basically take the almonds and then blend it, and then add water and then blend it, and then strain it. You unfortunately can't make good probiotic with the bottled or the boxed almond milk, primarily because it contains gum in it, and those gums, while they thicken the milk, they don't really allow the bacteria to grow. So it has to be fresh, or you can use coconut milk from the can. And then you would take a mason jar and sterilize it by using boiling water, and then cool it. Don't forget to sterilize the top also. Then you would take 2 probiotic capsules, making sure not to touch the actual probiotic powder, and put it in the milk. Let it sit in that environment, in a warm environment, for about 24 hours. And then after the 24, and it could also be 48 hours, it just depends on if you've refrigerated the probiotic or if it's been at room temperature. It just depends on how quickly that bacteria can grow. And then you're going to do a smell test, which just essentially, does it smell like yogurt? Does it then taste it? If it's got that tart taste to it, that means that it's probably done and you can refrigerate it. If there's any kind of discoloration, then you want to just discard it, because it's likely it got contaminated. Okay, what do you do if you're acutely ill? What should you eat? You can think about organic chicken soup, like pretty much a bland diet, because like I said before, the immune system, most of it is in your gut. So you don't want to bog it down with a pizza. You want to keep it just kind of simple and readily absorbable, because you actually have to put in energy to break down those chemical bonds to be able to extract the nutrients from the food. So the lighter, the more bland, the easier to digest, the less your immune system has to work, especially when you're sick. Think about soups with garlic, primarily because garlic is strongly antimicrobial. It's very antiviral as well. I would even consider consuming garlic raw, because the main antimicrobial chemical in it gets broken down and destroyed when you heat it up. Okay. Think about ginger tea. Ginger tea is also anti-inflammatory and also has antimicrobial properties, and as well as warming chai with some spices. And I would avoid the sugar ones. I wouldn't get, the chai powders. There's really nothing in it that would be helpful at that time. So if you're having an acute infection, think bland, think soups, because at least you're getting the hydration, and think also combining it with some antimicrobial herbs like garlic, ginger, and even throwing in some turmeric. So the general supplements for immune support that I recommend is BioVeg, because it has the high doses of vitamin A, C, and other antimicrobial herbs. I also have them do high doses of vitamin D3. So we're talking about 100,000 IUs. Now, if you have like a little dinky bottle of vitamin D, you might be squeezing for a while. So oftentimes these are like the 25,000 IUs per capsule. And really, you should also combine that with vitamin K, because vitamin K helps to modulate the calcium balance in the body. You can also do vitamin C, so 2,500 to 5,000 milligrams. I'm sorry, not grams, that's milligrams. So it ends up being 2.5 grams, 5 grams. Any form of probiotics, and then also doing some kind of hydrotherapy like the wet sheet wrap that I talked about. And also there's the magic socks. If they don't want to do the wet sheet wrap, then what they can do is do the magic socks, and this is great also for sinus issues, if they're having a sinus infection, if they're having a lot of respiratory congestion. Essentially what you do is you take wool socks, cotton can work fine too, make sure that their temperature is above 98, and essentially you'll dampen the socks, wring out as much water as possible, and then you're going to wear it to bed, okay? And then over the course of the night, your body temperature is going to raise up. You also will, most patients will report sleeping better because they don't feel as congested. And really, this is case by case, right? This is kind of generally, and it depends on the patient, I tell them to avoid any kind of anti-inflammatory, because I respect the inflammation response. The body's doing something for a reason, right? It's not just having inflammation randomly, especially in the case of an infection. You want to support the fever. You just don't want it to go very high, right? If it goes too high, like 103 to 105, then you want to make sure that you're being proactive, that they don't have any other issues. So fevers aren't innately bad. You don't always want to stop it unless it's absolutely necessary. Okay. So I do have an immune support protocol that I have available. You can get 10% off, and it's available at this link. Right.